Hi, I am Dr. Sandip Pal, consultant gastroenterologist working at Narayana R N Tagore Hospital, Kolkata. So today we will discuss about a procedure called ESD and EMR. So the full form of ESD is Endoscopic Submucosal Dissection and the full form of EMR is Endoscopic Mucosal Resection. Now these procedures are done for a condition called where there is a polyp or in the stomach or in the rectum or in the intestine or in the esophagus. So these lesions normally when there is a polyp in the stomach, we can cut it by endoscopy, which is known as polypectomy. But polypectomy is usually for the lesions which has got a stalk and which is nicely protruding down into the stomach. But there are certain lesions which are flat and which are very suspicious, which are early stages of cancer in the stomach or in the intestine or in the rectum. So this condition we cannot cut it through polypectomy because we need a negative margin in this. So the diagnosis of this procedure is of this condition is through endoscopy. So first we do endoscopy, and in endoscopy we can diagnose those lesions which has got a flat base or which is depressed. And if we think that these lesions look suspicious, we can do it by narrow band imaging. This is a technology in the endoscopy by which we can see the pattern of the lesion, and if the lesion looks suspicious and if the lesions are very superficial, if does not have an extension down into the stomach, then those lesions can be cut through this endoscopic procedure called Endoscopic Submucosal Dissection or EMR. So here what we do is we do an endoscopy and we lift the lesion and cut it through the edges so as to completely remove the lesion from the stomach or the rectum. So this procedure is usually done for early gastric cancer or for early detection, or for those lesions which can be detected early, and if this is a localized cancer or malignancy or suspicious for malignancy or have high grade dysplasia, these lesions can be treated endoscopically. So we have done a few cases of this procedure, and this is really rewarding because the patients can avoid surgery, and very early in the disease this can be removed from the stomach or the rectum and the patient can be cured of this. What is required is a high degree of suspicion, or those patients who have got a family history of cancer in the family, or endoscopy. Usually these lesions are detected accidentally, incidentally, like we do endoscopy for any other procedure, and we can detect these lesions if we are very careful. Or sometimes if the patient comes with bleeding from the rectum, so we do an colonoscopy and we can diagnose this. And so these early lesions can be removed by this procedure. Thank you.